the merits of possible drug diversion cases, and to educate veterinarians, physicians, pharmacists, policymakers out there in the public regarding diversion and abuse of controlled substances. So that's primarily what the prescription drug database is the goal of it. Now this is a pretty common occurrence that does happen quite often. Large quantities of opioids are in circulation, and drug abuse is at epidemic levels in this country. I want to give you an example of, well, let me just say this. Not only here in the States, but also in Canada, they have some issues associated with the problem with controlled substances. Some people believe that because you get a prescription, that would be safer to use than, say, some of your street drugs out there. Would this be a misconception?
Yes.
Yes. It's a resounding yes, because most of the drugs that are issued by prescription are the ones that are being abused. Okay. Just recently here in Montgomery, Alabama, not too far from us, there was a human prescriber physician who was basically picked up because that person has been accused of running a pill mill out of their operation. In other words, they're prescribing the pain medications on a routine basis in quantities that are red flag quantities, and for the patients. Now, in order for you, of course, to write a prescription, what would be the relationship that must be there? You must have a relationship between you as a veterinarian, client, and the patient. Well, the client and there's going to be a pharmacy, a triangle type relationship there. That's what I'm saying, for in order to be filled. Okay. You're going to, first of all, you do have to have that relationship there. And that cannot be a bogus relationship. What I mean by that is you must have an actual, some sort of relationship with your client before you can write that prescription. And establish that relationship for whatever disease state you're going to be treating them for. I want to emphasize the important fact that you don't want to spend all these years in school and have that right and privilege taken away from you because of not operating within the guidelines associated with the privilege to prescribe. Don't take it lightly. I can pretty much guarantee that somewhere along the way on this journey you will be approached about something that will probably be questionable practice. I know it didn't happen. It wasn't long after I started in pharmacy that you get all kinds of questions that come your way that helping somebody out, and so you have to be very leery about those kind of circumstances that can put you in jeopardy. But controlled substances, they believe sometimes they're safer than these street drugs, and they're the ones that usually are abused most often, would be the actual prescriptions that are prescribed. I don't know if you've heard of this case before, but I'm giving you an example of a person who is going to see a veterinarian in practice. And this particular information comes from drug diversion in veterinary medicine, and the officer is John Burke. He's was part of the DEA, law enforcement, for over 20 years or more. But in the small animal practice, there was a young man who had a dog named Dolly. Dolly would come to the practice, or would bring Dolly to the practice, and visited the local veterinarian. And of course, many times your patient may have anxiety or travel anxiety or something like that associated with Dolly, which was a canine, and a small dog, and that, of course, this particular owner knew very well what the symptoms were associated with anxiety for a pet. And they would indicate in very vivid fashion for the veterinarian what these problems were. Now, based on that, of course, you prescribe maybe a benzodiazepine for the patient. In this case, it was diazepam. And this was done several times within the same geographic area for that particular patient. So the patient owner was very knowledgeable about the symptoms for anxiety for the pet. And because of that, they were able to convince the veterinarians that they needed this particular medication or some sort of a benzodiazepine for their particular pet. And were able to acquire quite a number of the controlled substances through this process. As a matter of fact, 5 veterinarians were visited each month with the pet in hand and giving those particular symptoms, and the tranquilizers were prescribed. And of course, Dolly didn't suffer from any of these particular anxiety problems, but and of course they never got the medication. Dolly did anyway. So that was just one example of how a sort of a ring could get established where they would be going around to different veterinarians getting this particular medication. Another dog owner had an addiction for hydrocodone cough syrup. Okay, so they in turn visited the veterinarians, of course. And now this will show you to what great lengths a person will go for seeking medication. Now, have you ever known a dog to be trained to cough on command? I'm not making this up. This is an old case that they keep citing to. And I'll bring it out to your attention because it's one that's referenced a lot, and they say that the great lengths that individuals will go to get these particular medications. Now, this dog was trained to present the symptoms of a cough so that the veterinarian would believe that they needed this hydrocodone. Of course, hydrocodone is used to suppress the cough. And, but, I mean, the symptoms presented, you got the cough there, so medication was prescribed. So this went on for a while, and until finally, of course, it went on some time until someone caught on that this was an excessive amount of medication that was being prescribed to this particular person for treatment for their pet. And of course, it was not being given to the pet at all, but that was one particular interesting case. Another case that comes to mind is that sometimes a person will present to your practice or establishment and just indicate they want to get experience working there, they want to be exposed to the veterinary practice, they just feel like this may be their calling, and be very enthusiastic about working for you, and all of a sudden, maybe a few months into the program, they disappear. Well, this is what happened with a young man who was working for a horse track. And they were very enthusiastic, all the things I just described, but they were diverting anabolic steroids from that practice. And they ended up working there for about 6 months, according to the article, and left suddenly. But during that time frame they had diverted quite a few doses of the steroids. And another thing too is that if you are not in constant sort of checking how much of your inventory that you have, you don't need to let that just be given to anyone without a check and balance, okay? Because the number of doses that you order for your practice, all those things will be flagged, and you will come under scrutiny from just the number of doses that you start dispensing. Or if they're diverted, or if they get lost. When you do your tracking and inventory now, you can be off by a little percent, but you can't be off by 300 or 400%, okay? You're gonna have a problem, is what I'm saying. So you wanna make sure that you do have an inventory process in place that helps you keep up with the medications that you do have in stock, and to assure that they're not being diverted, okay? One case involved a veterinarian that was prescribing weight management medication for their pet. What would be a weight management drug? One that you know about, or may not know about. Weight management. Phentermine. Heard about that one? Really and truly, it's used a lot on the human side. Okay, but you would kind of wonder if you were prescribing phentermine a lot for a pet. Well, this particular veterinarian was doing just that, I mean, in large quantities. Matter of fact, the over-purchase reports show where they were dispensing like 2,000 to 3,000 pills a year. And this was supposedly to treat an overweight Labrador retriever. Well, if you're taking that many, I'm sure this pet was probably couldn't be overweight anymore, honestly. 2,000 to 3,000, and this is just one pet that's being treated. Well, when the investigators did ask the patient, the veterinarian, what was going on, really they had a family member that had the weight problem, not the pet. And they were writing the prescriptions, getting the medications, and treating the family member with those particular medications, which is way out of line for your scope of practice, right? So that was a major issue there. But this is some of the examples of things that can happen out there, and they can be a problem for you if you get caught up in that situation. What are some of the most commonly abused prescription medications? Yours? What else? Ketamine, absolutely. I've generated a little short list for you. Some of the commonly abused prescription medications. And you can see on the list, you have, what is, I'm pretty like, that's right. The amphetamines, highly abused like phentermine is one of those. Dextro, all of these would be medications that are abused, but they are many times prescribed though. Hydromorphone. You use a lot of that in junior surgery, right? Mm-hmm. Hydromorphone for pain management? Yeah. Okay. Meperidine, that is another name for Demerol. Methylphenidate, oxycodone, oxymorphone, and phenobarbital now. All of these are abused prescription medications. Now, we know that we are always concerned about pain management with our pets and with our subjects that we be prescribing for. And but you want to be cautious about the quantities, the amounts, and that if they get into the wrong hands, they can be abused. I want to point this out to you. Now, if you prescribe any of these things, for example, to go home which I doubt there's many of these would mostly be used in-house. But if they were going home, you better make sure that they are child-proof, secure, or that the owner has given you permission not to dismiss them with a child-proof cap from your establishment. Okay? But you won't. They pin you to the wall if the medication comes from your facility and it wasn't child-proof or secure, and it got into the hands of the owner's child or grandchild or someone else. And so you want to make sure that it at least was properly dispensed in an appropriate container from the facility that it's coming from. Okay. Fentanyl, diazepam, hydrocodone. The fentanyl we use a lot is injectable, of course, and it also comes in a patch form. Believe it or not, there are those who can take that patch and break it down so that they can get the contents from the patch. So we require that you bring the patch. It's usually for 72 hours that it can be applied for pain relief, and we require here that you bring the patch back and we dispose of it properly for you. So there are those that seek those patches, believe it or not, throw in the trash or whatever, go through to find those, and can reuse them or break it down to get the product out of it. Okay. Any questions about any of those on the list here? Now, the pentobarbital, let me point this out. This has been around a long time, but it's an old drug. Used a lot of times for euthanasia procedures. It was. Do you know anything about this particular one as far as in the press that we're talking about pentobarbital? What's that? What was that? It was, that's right. It has been placed in dog food. That's true. A lot of things are into the dog food chain. That's true. One of the this particular medication, pentobarbital, has sort of become in short supply, really, by itself. It was used for imprisonment system for the execution phase. Okay. And because of that, many times it became difficult to get on the market. Now we use euthanasia here, which has a form of this in it, and of course it's a special color, which is pink, to bring great attention to of course what it is for our purposes. But it is a medication that is also and was highly used on the open market as well. Pentobarbital. A lot of times we were using it for anesthesia procedures, but we sort of got away from that altogether. Okay. All right. Now these are some of the commonly diverted non-controlled prescription medications. Some of these we use, some of these we don't, but just sort of giving you some premise as to some of the things that can be misdirected. The lidocaine, diclofenac gel or cream that we do have, and we do have that for some of our patients here. The statins, HIV, we don't use that too much here, but some of these other drugs are commonly diverted sometimes. I threw this in here, just sort of a particular, if at all. What does purple rain and elephants, or what do they have in common? You may have heard somebody mention that. I brought this up a couple of years ago. Anybody got this? Huh? Ketamine. mean, not quite, but, well, I mean, it still could be a used product, but Purple Rain and elephants, what do they have in common? Okay, now, I'm not the greatest music buff in all the world, but you know, Purple Rain was popular by what musician? Oh, man, okay, I'm still alive here, okay, then. Prince, yeah. So, and you say, well, elephants. Well, what happened was that Prince, of course, had an overdose situation. But the medication, which was a opioid, was laced with a particular product. And they found out that it was laced with fentanyl, okay, which made it much more potent. Okay, so not only did we have an opioid situation, but it was also laced with fentanyl, which made it even more potent from the autopsy reports that finally came out. And you say, well, elephants. Well, there's a product called carfentanil, which is out there, which is much more potent than fentanyl, but it's a subset of that particular category of opioid. Have you ever heard of carfentanil? Okay, and carfentanil is used, of course, as a sedative for elephants. And with that in mind, it is very, very potent, is what I'm saying. Very extremely potent. And because of that issue, this has been sort of thrust into the spotlight as some of the problems that can occur with this particular product, fentanyl. And many of the products that can be laced